Hello, Motherhood Moment.
Yes, good morning, doctor. What is atopic dermatitis, and what are some of the biggest challenges that people living with this condition face?
Atopic dermatitis is often referred to as eczema by kind of the average person. So you may hear it referred to as eczema. Atopic dermatitis is the medical name, and it's characterized by red, itchy skin. It can start as young as a month of age, or it can kick in when you're an adult. But redness and itching is the hallmark symptom of atopic dermatitis.
What causes it?
Yeah, that's a great question. And there's a lot of theories behind it. There's not one thing. And that's something that I reiterate to my patients almost every day, because most people are looking for that one thing they think is causing their atopic dermatitis. They think it might be a food, might be something in the air, but there's often many things that can aggravate atopic dermatitis. And we know from scientific studies that there's always an impaired skin barrier. So there's skin that's going to dry out, it gets cracked. Things can irritate it much more easily than regular skin. And then there's an immune system that kicks in. It's a hyperreactive immune response, kind of an inappropriate response to those cracks. That's what leads to the itching, the inflammation, the swelling. Sometimes you can have cracked hands, bleeding from scratching, those types of things.
In this recent survey, what do you think is the most significant aspect of it and its impact?
Yes, well, I'm glad you brought up the survey. I have partnered with Dermavant Sciences, and I'm excited to be able to share some of the data from the survey. As a pediatric dermatologist and a father of 2 kids with atopic dermatitis, I can tell you that I'm not surprised that itch was a significant finding in the survey, but I was a little surprised to see that over 76% of patients complain that itch was really their number one symptom. And this is a survey that looked at over 500 adults with atopic dermatitis and almost as many, or actually 510 caregivers and parents of kids with atopic dermatitis. And they really mentioned that itch was really that number one symptom that they just have not been able to get relief from with traditional treatments. Itch can lead to sleep disturbances, often up to 4 nights of bad sleep a week. You know, if you can imagine that. I think, we take for granted good sleep. I'm thankful I was able to get a good night rest last night. I can't imagine if I was waking up in the middle of the night, scratching, getting blood on my sheets. And I remember when my kids were little, that was often something that would happen. They would come waking up in the middle of the night because they were just itchy. And sometimes we had no reason for why that happened. There wasn't like an obvious allergen in the air, an obvious change. It just, out of the blue, this itch will kind of take over.
How is it treated?
Yeah, there's a lot of different treatments that are out there, and there's really not, one thing that's for everyone. But we do know that moisturizers help, so that's a good thing to do. And traditionally, topical steroids have really been the mainstay of treatment. And while I've been thankful for those, they've really been inadequate because you can't use topical steroids for too long without side effects, and you can't use them on certain parts of the body. So there's definitely a need for better topical treatments that can control the itch and some of those other symptoms associated with atopic dermatitis.
What are the major takeaways that you want people, especially parents, to know about managing this in children?
Well, that's a great question, and I think what I want our viewers to know is that they can go to dermavant.com/sleep itch survey. They can learn a lot more about the survey results, as well as how to manage atopic dermatitis, and hopefully gain that information so that they won't feel helpless as they try to help their children or their adult friends and relatives with atopic dermatitis.
Thank you so much. I appreciate it.
Well, thanks for having me.
Have a good day. Bye-bye.